Donald Trump just signed one of the most sweeping legislative packages in recent history, a megabill packed with tax cuts, immigration changes, and quietly, the biggest overhaul to U.S. healthcare since Obamacare. Let's break it down. First up, Medicaid, the safety net for over 70 million low-income Americans. To help fund this $3 trillion package, over $1 trillion is cut from federal health programs, with Medicaid taking the biggest hit. Starting in 2026, adults under 65 will need to work, volunteer, or go to school at least 80 hours a month to stay covered, unless they prove they're disabled, pregnant, or in prison. But here's the catch. Even people who qualify could lose coverage due to paperwork errors and red tape. Supporters say it's common sense that able-bodied adults should contribute if they can. Obamacare subsidies are also getting a shakeup. Immigrants and even some green card holders will no longer qualify, and no more automatic re-enrollment, meaning millions must reapply every year or lose their plan. And now, eligibility must be verified before subsidies kick in, not 90 days after. The bill also effectively targets Planned Parenthood by banning Medicaid funding to clinics that offer abortions. Even in states where it's legal, nearly 200 clinics could shut down. For some communities, that's their only nearby doctor. Rural hospitals may be hardest hit. The bill cuts state provider taxes, which could drain $191 billion in funding. A $50 billion relief fund is included, but hospital groups call it a Band-Aid. The CBO estimates 12 million Americans could lose coverage by 2034. So is this a necessary reset or a rollback of progress? Supporters see it as fiscal responsibility. Opponents call it a healthcare crisis in the making. Either way, one thing's clear. This bill is about a lot more than taxes. Stay informed, not influenced. Subscribe for more breakdowns on the laws shaping your life.